This video is for education and entertainment purposes only. Please consult with your healthcare provider before making any changes to your health plan.
Hey, beautiful soul. It's Jacqueline here from the Labia Chronicles, where I talk about all things lichen sclerosus. So if you have lichen sclerosus and are looking to empower yourself with information, find acceptance, and reclaim your life, then please subscribe to this channel and keep on watching. And if you have a friend or a family member with lichen sclerosus and you want to learn more about the disease so that you can better support them in their journey, then please subscribe to my channel as well, and please share my content with them. All right, beautiful soul. So today I am so excited and so honored to be joined by Suzanne, the founder of Private Packs. And we are going to chat about vulvar itch and vulvar pain and vulvar inflammation. And of course, we're going to be chatting about private packs. So if you have lichen sclerosus or any kind of vulvovaginal condition, this video is definitely for you. You are definitely going to want to learn more about this product, so keep on watching. And as always, if you like the information in this video, please give this video a thumbs up. So Suzanne, yay, you are here. I am so happy to see you. I'm so happy that you are joining me today. So why don't you say a little bit about yourself, you know, kind of share your health journey and what kind of, you know, inspired you to create Private Packs?
Okay. Thank you so much for having me on your show. It's so nice to be here, especially with a fellow Canadian. Hi, everyone. My name is Suzanne Sinatra, and I'm the founder and CEO of Private Packs. And I created our product first from our Brazilian wax, which is a removal of all the pubic hair down there, left me with second-degree burns. It was so painful. And I just couldn't come home and put on a bag of peas on her. I couldn't do it at all. Because on top of that, like, not only is it bulky and just cumbersome to deal with, but I don't know if that bag is clean. Because grocery stores don't care about frozen bags of vegetables for the private body parts, or if you have a store of muscle that's an open store, and that can actually make things worse because you're introducing an unsterile product to open skin. Which, listen, if we did anything in school, I mean, we know as kids, don't put dirty stuff on fresh cuts.
Absolutely.
So then I was going to launch the company in 2017, and right before my crowdfunding campaign, I actually found a lump in my breast, and they found it was breast cancer, stage 2, that quickly progressed to stage 3 cancer. And because my cancer was estrogen fed, they had to stop my estrogen and put me into menopause. And then I started to deal with menopause-related vaginal dryness, which is something chronic that I deal with, just like lichen sclerosus. And it's been a learning process. And actually, it became a new use case for Private Packs because it is a management tool specifically for vulva vaginal pain.
Yeah. Totally. And so for folks that aren't familiar with Private Packs, can you tell us a little bit about the product? What are they? How do you use them and stuff like that?
Great. So Private Packs are hot and cold therapy packs that are shaped for the vulva. So you don't need to use a back therapy pack that you would use if you're spraining your back or if you fall down and you injure yourself and try to consort it into a shape that fits between your legs. Private Packs is already shaped for your private body part. So it curves to your natural curvature of that body. And it can be reused multiple times. It comes with a reusable protective sleeve that you could soak. And if you use the pack either cold, which is putting it in the freezer to 2 to 2.5 hours, you can also put the sleeve in the freezer to make it extra cold. Or you can put it in the microwave for 8 to 10 seconds. And if you don't have a microwave, you can place your Private Pack in a bowl of hot water.
Oh, that's a great trick.
Yes, because not everyone has a microwave. Not everyone feels
No.
comfortable with radiating their food like I do. So they rather put it into a bowl of hot water, and then you could pre-moisten your sleeve with, say, witch hazel or a vitamin E oil or a jojoba oil, and that makes it from dry heat therapy to moist heat therapy, which is more penetrable to the skin.
That's genius. And I love that you say this. And I had to I was laughing in my head about the microwave because I live in an apartment where if any of the like appliances break, we don't go out and buy a new one. We have to get like the superintendent to order us a new one. And so our microwave actually broke during COVID. And because of
Oh,
COVID and like supply issues, we did not
yeah,
have a microwave for like almost a full year. So when you said this, I was like, actually, that's not such a strange thing because some people choose not to have microwaves. Some people
yes,
can't afford microwaves. Some people's
yeah,
microwaves malfunction. So that is so, so
yeah.
smart. And I love the adding of the jojoba or vitamin E or something really
Mm,
moisturizing because I think that's something that it's definitely something that folks with lichen sclerosus struggle with. And
mm-hmm.
different types of, vulvovaginal diseases and conditions come with dry kind of vulva. And so that can be so soothing to so many people to
Yes,
have that. So I love that. I love that you
yes.
mentioned that.
Yeah, and the thing is with the hot and the cold, and why I recommend buying either a single pack, a 2-pack, or a 3-pack based on your symptoms, because you don't know what you're going to need it for. If you have a Brazilian wax that you get every 6 weeks, buy the single pack, buy it in
Mhm.
CVS. It's one time use every 6 weeks. If you have lichen and you want to be intimate with your partner, you may want to use the hot the therapy pack hot,
Mhm.
moisten the sleeve while you're getting some sexy foreplay in. Then after you have penetration, use the cold to reduce the swelling. Because there is a use case for the hot and the cold use. But you use
Absolutely.
it for whatever you need.
I am loving this. You are just dropping so many gems in just the first
Yeah.
couple of minutes. I'm like, this is so smart because what does heat do? It encourages blood flow. And when we
Yes.
think about sex, right, we want blood flow to the sex organs, to the clitoris,
Yes.
to that area to encourage arousal and also kind of relax those
Relax.
muscles,
Yes.
right? Because that's a big
Yes.
thing for people with lichen sclerosus is a lot of us because we experience pain with sex, our pelvic floors and everything really tighten up. So we get
Right.
so like bound and tense. And so heat really helps calm those muscles down. And that's what we
Yes.
need to help
Yeah.
make sex, more pleasurable. And then again, adding that moisture is kind of encouraging that. So I think that's fantastic. And then for folks that experience some soreness afterwards, then you bust out your cold one that's been sitting in
Right.
the freezer and you
Right.
use that to kind of calm down any kind of soreness or burning that can sometimes happen.
Right.
Definitely happened for me. Like I would always feel burning after sex. If not burning, I was definitely sore. Um,
Mm-hmm.
so in my 20s, I wish I had this wisdom. I wish I
Mm-hmm.
knew, to even like, it didn't even occur to me to take like a bag of peas back then. Like, because I don't know, I just thought this is normal, I guess, right?
Well, I don't. I think it's normal to not go for something because we're not taught to how to manage sexual discomfort.
Yeah.
We're taught about reproduction or STI protection.
Yes.
Right. But no one talks about the pain you're going to feel if you've been spinning on your Peloton for a week and you're like, you look at the bike and just looking at it is painful because you're just like, that bike was bought for me to lose weight, lower my stress, but now it just causes me pain. Now I can't sit in my chair and work from home.
Yeah.
So that is really like the bigger cause of private packs, which is to like recognize that you have issues down there. One, it's normal. That doesn't mean you're dirty or you're a slut or whatever other taboo comes from your discomfort. And here's a manageable solution for you to use without having to see a doctor because it's just soreness. Or you know what the symptoms are. One of the symptoms may be chafing, either from using a dilator or penetrative sex. This is something that can help you manage your pain better. Because like vaginal dryness, lichen is chronic.
Yeah, absolutely. And so for folks that are kind of new here or aren't super familiar with lichen sclerosus, I'll kind of give a little Coles Notes overview
Mhm.
of, what lichen sclerosus is. Now, of course, I do have a video called What is Lichen Sclerosus and Is It Serious? So if you want a kind of more in-depth explanation, I definitely recommend checking out that video, which I will leave a card up here, and I will also leave that linked in the description box below. But briefly, lichen sclerosus is a chronic inflammatory skin condition. It can affect other areas of the body, but it primarily affects the genitals. So the vulva, the perianal area, and it can also affect the penis. But for the purposes of this video, we're going to talk about kind of the vulva and perianal areas. It's widely considered to be an autoimmune disease in the medical community, and it can cause a bunch of symptoms, but the two big symptoms that we see the most are itch and pain. And not everybody has both. So some people just have itch, some people just have pain. And so for people with itch, it can be a kind of mild, annoying itch that's kind of there on and off, or it can be very severe and very debilitating. Like I know people that say that they developed insomnia because they couldn't sleep at night because the itch was so severe. I know people that have holes in their underwear from scratching, like holes. Think about how severe that itch has to be for you to tear through your underwear. So the itch for people with lichen sclerosus can be incredibly severe and really, really, really impact your quality of life. And similarly for pain, and pain again can present differently for different people. For some people, it presents more like burning. For other people, it's more like stinging. I used to describe it as saying, I would say, it feels like someone kind of made a bunch of paper cuts all over my vulva and then like squeezed a lemon on top or like poured rubbing alcohol. And like that was the sensation that I was left with. Sometimes it's just general soreness and discomfort. But, we've got a big window of pain. And so this is chronic. It's a disease that, there's no cure. So there are treatments, of course, to help get people into remission and to help manage symptoms. But these treatments are not foolproof. And sometimes we need a little extra help. Especially in the beginning when you're waiting for your medication to really start working, you've still got to you have to live with the itch and the pain and the burning. And so, if there are things that you can use to help manage those symptoms and make it more like livable and bring your quality of life back to something, something normal, something where you can be joyful and be your authentic self, it's like, then that is amazing. So I think, for people with these chronic symptoms of itch and pain, how do you see private packs kind of fitting into their treatment plan to help them with those symptoms?
I see private packs fitting into the treatment plan just as an additive product to what their doctors have already prescribed to them. And I believe it's intuitive because most people have had a hot and cold pack. I think what the bigger question is, do they even know what they're dealing with? How easy is it for the doctors to diagnose lichen sclerosus? I mean, for you, Jacqueline, how was it for you? Did you have to go months before you had your diagnosis?
Oh my gosh, I went years. I went
Wow.
almost over 10 years to get my diagnosis. Because I was a grad student, grad students tend to hop around a lot. And so we're not really seen by, like, I didn't have a general doctor that was following my case. So, this started in my 20s. It started with pain with sex. I would tear, like my vulva, the perineum would tear open with sex. So pain and tearing was really my big thing in the beginning. And then towards like my mid 20s, maybe 25 or so, that's when itch started coming. And then I started to fuse, and it just kept progressing because without treatment, it is a progressive disease. So, I was going through all of this for 10 years, and I was in and out of doctors' offices saying, I'm in pain. It hurts when I have sex. And they would tell me, yep, that's part and parcel of being a woman. Welcome to womanhood. I was told just do yoga, which was always really comical to me because I would literally come to these appointments in my yoga gear with my
Mm-hmm.
yoga like mat, which you can like see in the corner there, like
Mm-hmm.
strapped and my yoga gear. I'm like, I do yoga. Like I'm all for yoga. Yoga is excellent on, calming the nervous system and has so many benefits, but I don't think that's what's going on here. I think there's something deeper than this. And it just kept coming back to, well, you're just too stressed or your partner's penis is too big. And they basically painted me as this like anxious, frigid person that
That's
just
crazy.
needed to chill. So they would actually tell me, two doctors told me, two separate doctors said, maybe you should try some wine, like have a glass or two of wine. And I was like, I'm sorry, but that has got to be the worst advice that you could ever give a patient. First of all, you don't know my history with drinking.
Right.
And, like you could be telling an alcoholic that. You could be creating a problem because now you're
Mm-hmm.
basically telling me almost implicitly or indirectly to use
Drink.
alcohol as a crutch,
Yeah.
right? And so
Right.
I could even develop a problem because I might use alcohol as a coping mechanism for painful sex. And in fact, I've spoken to people with lichen sclerosus who told me that they used to drink to have sex because that's the only way that they could get through it, which is really, really problematic, right? So
Oh, huge.
yeah, and I just kept getting these answers. And so finally, after I did my PhD, I moved to Toronto and I got a family doctor. And I went to go see her about something completely unrelated. And then somehow I mentioned my vulva. And then she said, like, oh, wait, hold on. Sorry, what? Can we talk about your vulva for a second? And I said, like, oh, okay. She goes, so what are your symptoms? And I said, well, I'm always itchy. They say it's yeast, but yeast infection medication does nothing for me. I'm always itchy. I'm always in pain. I always tear during sex. And she goes, do you mind if I have a quick look? And I said, like, what's one more person looking at my vulva at this point, right? Like, you will be doctor like 170. Sure, let's do
Right.
it. So I go in the office, I undress, get in the little stirrupy things, and she takes one look at my vulva, and within 1 second, she goes, oh, you have lichen sclerosus. And I said, I'm sorry, what? And then she started to examine a little bit more in depth, and she
Mm.
goes, has your vulva always looked like this? And that was a statement that really stuck with me for a very long time because I realized that on her table at 31 years old, I had no idea what my vulva really looked like. I had
Oh,
never looked
wow.
down there. So I was like, I don't know. And she told me, okay, well, the vulvar skin, which on you should probably be a pinkish color, is all white. Your vulva is
So there's
like
no blood down there.
paper, like it's
Yeah.
white and it's like very thickened in some areas, and you've lost a lot of anatomy. So, and I'll pop a little image of a vulva up on screen, but I lost my inner lips, so that labia minora completely gone. They basically reabsorbed into the labia majora. So I no longer have that structure. The clitoral hood
Yeah.
completely fused over the glands. So my clitoral glands is like completely buried under the hood. So you can't retract, you can't see it, you can't visualize it, which, causes issues with sensation. So for a lot of folks with lichen sclerosus, they'll have reduced, sensation, muted orgasms, stuff like that. So my vulva, I basically had to lose a lot of architecture, and my vulva had to turn completely white for someone to finally be like, wait a minute, you have this disease and you need to get treated, because 10 years without treatment is a very long time.
Yeah.
And so that, months, yeah, no, it took years. And in fact, the average time for folks to get diagnosed with lichen sclerosus is 5 to 10 years, which is very very long time. So
Wow. Okay.
yeah, that's the average, right? And some people I've heard longer. I've heard 30 years. I've heard, just some really awful stories out there. So, awareness is really important, right? The more that we kind of build awareness about this, the more this is going to be on doctors' radars, the more people will
Hmm.
advocate for themselves, because coming back to the point that you brought up earlier, yeah, sex ed was about babies and STIs. And that was kind
Yeah.
of it. I thought that itch, vulvar itch, meant you had a yeast infection or an STI. In my head,
Right.
there was nothing else. So, like, in all that time that I was searching for answers, I was in the STI clinics all the time. And I was praying that they would tell me I had a sexually transmitted infection because I needed an answer. I was like, I
Right.
can't be making this up. But
Right.
in my head, that those were the two things, like, because nobody talks about menopause and the changes that come with that. Nobody talks about these things. And that's really problematic. So it was hard for me to really advocate for myself because I just assumed, well, like, it's either a yeast infection or it's not, you know, or it's an STI or it's not. So when I got that diagnosis, it was very validating, but then also very scary because she was
Right.
immediately like, it's autoimmune, there's no cure. I'm going to give you a steroid ointment and you're going to use that forever. And that was really hard for me to wrap my head around, that forever piece at first. I was like, forever? Like, what do you mean forever? But, you know, I didn't really have much more conversation because, you know, we only have like 5 to 10 minutes with the doctor. So
Right.
at that point, she was kind of like, here's the medication, apply it, and we'll set you up with a gynecologist. And I was like, okay, cool. So for me, the medication didn't really work right away. I always tell people that I expected it to work like penicillin works for strep throat. I thought that I was going to use this medication and in a couple days I was going to see a huge difference, and then 7 days it would be like I never had it. That was my kind of expectation.
Mm-hmm.
Very quickly that was shattered. I think it took, you know, about 3 months for things to start feeling
Oh,
better.
wow.
Yeah. And on average, the time that it takes to get an LS patient into remission is anywhere from 3 months to 12 months. So it can take folks up to a full year to really, really see a big difference. So that means that there's still a big time where these symptoms like pain and itch can be a big thing. So for me in the beginning, ice was my best friend because I still had the pain and I still had the itch. But at this point, I didn't know about private packs. So what I did was I took those classic ice packs, you know, the kind that you kind of like stick in your kid's lunch bag or you use when you go camping and you throw it in the cooler. That's kind of what I was using. And so, you know, that did the trick. It really helped. Like I found ice was the only thing that helped with my pain and my itch. However, there were some drawbacks to that, right? Because it's so clunky and rigid. And so it wasn't exactly getting like ideally where I wanted it to go. You know, like I'd have to really like maneuver it in a weird way. And then I had to stay there. So, you know, I couldn't walk around my apartment. I basically could only do it when I was lying down or sitting. And I couldn't, yeah, exactly, at home. And also not when other people were there. Because if I had like guests or friends over, I felt kind of awkward with like, you know, either a bag of peas or like an ice pack just like in between my legs. You know, it just felt kind of awkward for me. And, you know, I always want to have to explain that. So then, you know, I was on Instagram and this is how I found private packs and I'm reading about it. And then I go onto the website and I'm like, this is genius. This solves all of the issues that I have with kind of frozen peas and the ice pack because it gives me that cold. But now we have something that actually fits. So it goes kind of from the clitoral area all the way to the anal. And it really hugs that area of the body so well, unlike, you know, the ice packs that you can't really move much. And even a bag,
the generic
like,
ones.
There's only so much you can do. And so I loved that it actually like fit the area. And then I was obsessed with the like discreetness of it all. I was like, oh my gosh, this is amazing. Because for people with lichen sclerosus, we can't control when the itch comes, right? So this means that if you're entertaining people.
Same with menopause, vaginal dryness.
Yeah.
Exact
You
same
have
thing.
no control over that. So if you have people over and then all of a sudden you're like that dryness hits and you start feeling uncomfortable.
Yeah.
And then you're like, oh my gosh, you're in your head because you're trying to entertain your guests. You're
Mm-hmm.
trying to be present, you're trying to be in the moment, but then you're just like, so like, oh, it's driving me nuts. But
Yeah.
again, all you have to do now with private packs is say, I'm just going to the bathroom, go into your freezer, grab one,
Scoop it on.
you stick it in your underwear,
Mm-hmm.
and then you go back and sit. And so when I got my private packs, I kind of like ran them through a big test. So I wore them at work where I have a
Mm-hmm.
standing desk. I wore them seated. I went on the subway with them. I went walking. I like tested them in all these things. And so I loved the flexibility that it gave me to use this when I really needed it, and to also use it discreetly when I was in a public space. Like there was one time I had coffee with a friend and I had one in. This coffee shop was like, 10 minutes down the road. So I just
Mm-hmm.
popped one in, walked there and sat with it in. And like, I don't think anyone in the coffee shop would have any idea that it's in there because, for folks watching, this is kind of what the pack looks
Yay.
like, right? And this just sits in your underwear. And then, of course, as Suzanne was saying, it comes with these protective sleeves.
Right.
And so that protective sleeve helps because you never want to put just ice on the vulva,
Oh,
right?
that's a big no-no.
Private packs
Big
or
no-no.
otherwise, you never,
Yeah.
ever put ice directly onto the body like that.
And that's also for other body parts.
Yes.
You never put bare ice on your body. Your skin, your dermis doesn't like it. And when I created private packs, I only created it from my personal needs. I didn't know there was a plethora of women that have chronic pain down there because unbeknownst to most people, especially non-vulva owners, we women don't know everything that happens down there.
Mm-hmm.
And most doctors, including gynecologists and urologists, don't know everything, just as you explained with your medical journey of your genitals. So really, it was, private packs is really like my ode to vulva owners. It's a love letter. And I really just kept reiterating it because I wanted it to be discreet. Because not everyone could plug in a heating pad under their desk at work.
Yeah. Yeah. Right.
Right?
Like,
Not the mom's got to eat, hold her newborn. Then what happens? She's got to stop healing her privates? Like, that doesn't make sense. And nothing was fitting our lifestyle. So I did, as most startups do, we try to go and get investors for our companies. And I got turned down from 145 people. And I'm like, no one sees the need for this. I'm like, what am I losing?
How?
What am I not getting? And I was like, you know what? I made this for vulva owners anyway. So as long as customers and other vulva owners want and need this, I'm going to keep going until I'm in the grave.
Yeah.
I don't care if investors don't want us. And what's been so great, especially here in the United States, is that CVS picked us up because they understood the need of their customer and that providing this on their shelf helps the customer's buying experience for their self-care. So we're like right around Monistat and Azo and across from the pads, which is the right aisle. Like we shouldn't be where all the other ACE bandages are because female health requires more. It requires more options given to vulva owners because we're not always given the pinpoint exact diagnosis for what is ailing us. And we're not always given the correct treatment, as in alcohol, to cure our problems, manage them. And I'm really sorry, Jacqueline, that someone treated you that way because that goes against their whole oath. Like they have an oath.
I know. Do no harm.
Right. Do no harm. I don't know who would think that prescribing alcohol wouldn't do harm, but that is a really big eye opener into how this opioid crisis started.
Right. Right. Yeah.
Because they'll do anything just to get the patient in and out. Because to your point, if a doctor could see a patient every 10 minutes, that's more payment for them. So they just need you in and out. And at one point early on, they hated Dr. Google. Now they recommend, they even expect you to come in with Dr. Google to your appointment to help them. Not to get you a better diagnosis, to get you in and out.
Yeah. And so if you think about it, then they're not going to have time to make all of these recommendations for
Right,
lifestyle, right? And so like,
right,
you know, they have the time to tell you steroid ointment, use it, blah, blah, blah.
right,
I
right.
use my steroids. Don't take this as me knocking it. But that means that they're not checking in on your mental health. They're not checking in on your sexual health. And they're not talking about lifestyle things because, okay, steroids, but steroids don't fix everybody's symptoms to 100%. So they don't think to say things like, use ice, use warmth, use, you know, I mean, the trick of putting like jojoba oil and stuff, I that's genius. And that's so smart. And they're not going to have the time to tell you these things. They're not going to have the time to tell you things
No,
like
no.
before sex, you know, try some warmth to the area to get blood flow, but to also relax the muscles. They're not going to have the time to tell you these things, right? So,
Right.
so much of that gets missed. And then so
It
people
does.
kind of feel like, you know, well, what else do I have? And then for folks also that don't have their diagnosis yet, right? So for
Mm-hmm.
folks that are watching and they're feeling itchy and they
Mm-hmm.
haven't got diagnosed with LS or, you know, they don't know what it
Mm-hmm.
is yet, this can at least help in the interim to help
Mm-hmm.
you manage that symptom. And like you said, there are so many reasons to have private packs. Like I was talking to a friend who recently gave birth and she's breastfeeding. And she said that with breastfeeding, she's really dry. Her vulva feels really dry and really itchy. And
Yes,
I
because of
was like,
hormones.
girl, you need to get private packs because
Yeah.
you're a new mom, which means Lord knows you are going to be running around and always on the move. Like you don't have the
Mm-hmm.
luxury of I'm going to sit and just
No.
da 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 da. No, you need something, grab it from the freezer in the underwear it goes. And then,
Mm-hmm.
you know, you nurse your kid and you do all the things. And yeah, and so something as simple as that. And again, we're not taught these things. Nobody tells you that you can, you know, the hormone changes that happens after you give birth and all of the implications that has, they don't tell you about that.
Right.
So
And on the other flip side of that, though, some people are afraid to ask the question
that's true too.
because they
Yeah.
are fear of judgment. And I really want people to see private packs just like a podcast, just here to help you manage your care better,
Absolutely.
just to
Yeah.
empower you. And we don't want to overcharge people just to say we have a markup. We charge $19.99 in store and $29.99 online because you get more product when you buy our product online versus in store. But
Mhm.
it's like two $20 bills or $20 bills. In
Yeah.
the sense we are reimbursable for a healthcare expense and we are sales tax exempt because it's the least amount of barrier for you to get healthy.
Right.
And
And
that's
they're
why you will find us,
reusable. So it's not
and they're
like you have to
reusable.
discard
Right,
it and buy a new
right,
pack every week because that would be
right,
costly, right? Then
right,
that would be maybe unsustainable to expect that somebody has to buy a pack for every week. But
right,
no, you can reuse them.
right.
So, you know, I to me, I saw it as an investment. And I always say that I encourage, especially people with LS, I always say get more than one. I'm with you. If you're just doing the Brazilian wax and you want something for afterwards to kind of cool things down, like I'm with you. One is fine. But if you've got
What
a
is that?
chronic condition, I say get a few. I like to have what I call my private packs assembly line. Like I've literally got them so that, you know, I use one. Okay, this one's not so cold anymore. We're going to swap it out. And then I can swap it
Yes,
out again. And I just keep that assembly line going. And I
yes,
love that.
yes. Like, and that's a type of chronic infections like, or chronic issues like vulvodynia, vaginismus, vaginal dryness, which is what I deal with. Because again, I started off with a Brazilian wax, and here I am now with chronic
Yeah.
vaginal dryness, and it's always a thing. We are looking to extend into more products because I'm learning there are more issues.
Oh my gosh. Yeah. And there is demand for it. You know what I
Yes,
mean? Like I
yes.
talk to people every single day and I'm like, you need this. You can
Mm-hmm.
benefit from this. Like you said, vaginismus, vulvodynia, all of these things. Like
Mm-hmm.
vaginismus, again, use the warmth before you use your
Right.
dilators. Get that jojoba oil on the sleeve afterwards to
Yeah.
kind of like bring irritation down, bring moisture down, bring some more soothing. Like there's so much need
Because
for this and I love
yes,
it.
yes, because when you apply oil or any type of lubricant or emollient, like say Aquaphor, which is what I use a lot,
Mm-hmm.
I use Aquaphor because it's got a thick consistency. Because I deal with chafing, so just walking just is a pain.
Yeah.
Even though it's great for my health. So the Aquaphor consistency is so thick that I can put it on my labia majora, because I'm feeling I don't have a menorah anymore, which is a whole nother conversation. But I digress. So I use the Aquaphor there, and then I put on the heat pack to make the Aquaphor penetrate and to make my skin more supple. Because you want juicy skin that prevents the chafing from starting earlier. Whereas if you have dry skin, it's gonna instantly get chafed.
Yeah.
And that chafing takes like a good 2 to 3 days to come down.
Oh yeah, it's such a
If
pain.
it comes
And
down,
so
yeah.
many people have that, right? Like so many
Yeah.
people will tell me that. Even folks that have like no vulvovaginal issues at all, they go out in the summer and take a long walk and they're like, oh, like my vulva area and my inner thigh area chafing
Oh,
like
yeah.
crazy. And it's just like, yep.
Yeah.
Like
Yeah.
such a common thing.
And you don't want to use, say for instance, a deodorant stick, even though it would make sense. But the deodorant stick where you rubbing it causes drag.
That's
Whereas
true.
an emollient, you can put enough on your hand where it won't drip, but it's just a touch to make it slicker. Again, these are all the things that we vulva owners that got vulva issues have to deal with, but knowing makes you better at managing your care.
And I think, you know, one of the things that I'm thinking as you're speaking that I love so much too is that there's so little risk that comes with this, right? When we talk about side effects, when we talk about choosing treatment plans for whatever vulvovaginal condition you have, a lot of them come with some pretty scary side effects. Now, when we're talking about, you know, something like private packs, it's like there are so few side effects because, again, the one side effect that I can think of with ice is applying the ice directly to the vulva. But again, because private packs come with this protective sleeve, then we don't have that issue, you know? And so it's like there's so little side effect that you have to worry about, which can be really nice because people with chronic health issues always kind of have to weigh out like, okay, risk and benefit, risk and benefit. And this is just like, there's so little risk and so much benefit. So it's just like, to me, it's win-win. So like, oh, thank you for creating this product. Because,
thank you so much. Thank you. And even like for those people, because we do have customers from Canada and from Europe, if someone's in a financial bind, people just reach out to me like, Suzanne, like the shipping is like $40. The thing costs $30. Like, do you have something? We have a special for Canadians. It's Canada for a discount off, because I don't want anyone to go broke for finding care. That's not right. Yeah.
I hear that. I offer support calls for folks with lichen sclerosus. And I'm always like, if you can't afford it, reach out to me. Let's talk, you know, like I'm willing to do a sliding scale. I'm willing to do a pay what you can, but reach out to me because I don't want anyone to say like no because of financial reasons when it comes to their health. We'll find a way to make it work. So I love that that's your approach as well. I love that. It's so accessible, so inclusive, and yeah, that's just absolutely fantastic.
And you know, maybe like that's the underlying benefit of being unable to get investors. Like I don't have to meet a certain metric by their standard. Like we want you to be a multi-million-dollar company in 12 months. Like I can grow so slow and offer discounts if people can get the help that they need. Maybe that's too Midwestern or Canadian. I don't know, but it's working for me and people are happy.
I think it is Canadian and I'm here for it as a fellow Canadian. Because I have the same mentality and I always have the Americans that are like, no. And I'm like, but.
Right. But it's okay.
And I'm okay with that. Yeah. I'm okay. I'm okay with that. And I know you are too. And I love that. I'm here for that. So we're getting towards the end of this video. So, you know, if folks want to get private packs, if you do want to use, I do have an affiliate link. You can go to privatepacks.com/Lost Labia Chronicles, and then you use all capital letters the Lost Labia Chronicles at checkout for 15% off your first order. I will leave that information in the description box below. But then, of course, if you are in the United States, you can get them at CVS as well. And then, as Suzanne said, if you are, in a part of the world where it's difficult to get it and shipping is too much, reach out to Suzanne and
I'm on the chat.
They'll get you sorted out and
Yeah.
all of that. Suzanne and I both just want folks to get, their symptoms managed and to get some relief and to feel better at the end of the day.
That's all we want.
Yeah.
That's it. Yeah.
100%.
Just empower everyone that healing really is attainable.
Yeah, absolutely. So is there anything else that you wanted to mention that we didn't get a chance to talk about before we close?
No, I just want everyone to know how fabulous you are, and the content that you put out is really fantastic, and that they should all follow you for anything lichen or vulva related. You are a really great resource, and I thank you so much for what you're doing.
Thank you so much, Suzanne. Thank you so much for being here. Thank you to everyone who watched. If you already use private packs, let us know in the comments below. If you're going to get some, let us know. And if you have any questions about the products, put those in the comments. Happy to answer those as well. So that is it for this video. I will catch you in the next one.
Bye, everyone.
Bye.